Let's talk more about the maintenance of therapeutic levels. Um, in general, we want our concentrations to not vary a whole lot and kind of hug this curve that I show here until they reach steady state. If you notice how when we administer another dose of a drug, it increases the amount of the drug in the system, and then it will drop to a low level and then go up again and down and up and down. If these doses were of a drug that we don't want to go too high, say it has a maximum effective concentration that is very close to a minimum effective concentration, that's what we call a narrow therapeutic window. So it means that we'd want to keep that drug, let's say that 1.5 was the maximum effective concentration, and in this example, we're going over that. Um, and 1 is the minimum, so we want to keep it between 1.5 and 1. We would want to maybe give a little bit less each time so that it did not exceed the maximum effective concentration. So the amount, the times that we administer, the amount per day that we administer, that will keep us closer. If we have a high number of, let's say we're giving a drug 4 times a day, we're going to keep things pretty close to our curve. We're not going to have wide swings in the concentration. But if we're giving something once a day, unless it has a very long half-life, we could go way up and then way down before we're going way up again and way down. And in some situations, that is actually a desirable thing. We just need to meet a certain maximum concentration in a certain time interval, and that's fine. But in other cases, we want to keep that dose very steady and in a very narrow therapeutic index. So we're going to talk about how we administer drugs and how that affects these swings and getting to a steady state concentration. So I talked about these terms. I'm going to go to the routes of administration. And you can see that there's a variety of ways that we're giving medications to these animals in these pictures. So that kitty cat that has something over its face, it's getting a dose of probably a bronchodilator, probably has some kind of asthma problem. Cats are somewhat prone to that. And so it's breathing in a mist of a medication, and so that's an aerosol administration. Um, the dog who's being bathed is getting a topical medication administered to it, just to the skin. And then you can see that dog, and I'm assuming that's an intramuscular administration, although I would never want to be restraining and giving an injection like that at the same time without having more control right at the site of injection. Um, so there's a variety of ways that we administer drugs and how quickly they will affect the animal. Probably that aerosol is going to get right into the lungs, right into the area that we want it to, so it's going to act very immediately. The topical administration, we're going to get that right on the animal's skin, and that will hopefully protect it right there. But the injection is going to take a little bit longer. So there is, in the injection area, there is something called parenteral injection, and that just implies that we are placing a drug in the space between the surface of the body and the GI tract. So if it's going directly into the GI tract, that is oral administration. But anything, under the skin, so we're eliminating topical, um, and we're eliminating that inhalant, but we're going right between the skin and into the muscle, or under the skin, sub-Q. We could even go intradermal, which is right into the skin, or we can go into a vein, and that would be an IV administration. So two types of IV administration is what we will use. And the first would be a constant rate infusion. And this is what happens when you have a constant rate infusion. This is the plasma drug concentration, so that which is in the blood, and this is over time in hours. And so as we start, if we put in a catheter and we start to give an IV infusion directly into the vein, the drug concentration is going to, depending on how fast we're dripping it, and this is a horse getting an IV infusion. This is how we give horses that these are several 5-liter bags that are mounted, and as one empties, the next one will provide the flow into the horse's catheter, which is in the neck somewhere. This looks like a horse that has colic because it has a muzzle, so it won't eat. It's just getting fluids. So gradually that drug would increase in concentration and then reach the steady state concentration. If we give a loading dose, or what we call a bolus, an IV bolus, where it's like dumping extra water into our bucket, in our bucket analogy. And so immediately the blood concentration goes way up, but then it starts to decrease and until it reaches zero. But if we give that bolus, it's a loading dose in effect for an IV administration. And it's going to bring our blood plasma concentration up about to the level we want it, and then we maintain it with a constant rate infusion of that drug after that. So, in talking about parenteral injections, we administer things into the vein. You probably learned this last semester that we want to be able to distinguish between an intravenous injection and an intraarterial injection. I hope you talked about why. So I want you to think about where does an intraarterial injection go? What direction is that headed to, and where will it end up? Let's say we give an injection in the jugular vein of a horse versus a carotid artery injection. So, where does the jugular vein injection go? And where does the carotid artery injection go? If you said that the jugular vein injection goes to the heart, you're correct. The veins go to the heart. After they go to the heart, they are diluted with other blood that goes to the heart. So we're diluting our drug. And then after it travels through the heart, it's going into the arteries and out into the tissues. That's desirable. If you think about where the carotid artery is heading, it's going pretty much to the brain. It's hitting other things in the neck and the head of the horse, but it's going to the brain. And it's not very dilute. We haven't diluted it with the other blood in the body. And so that could be too much, and certain drugs will cause horses to seizure if they are injected into the carotid artery. We have to be very careful. That is one place where as you know, the arteries and veins do run close together, but in particular in the horse, they are very close together. So that's why we always want to pull back on our syringe, make sure that we're looking at the blood, that first of all, we're in the vein. That's where we want to be because we want that drug to be diluted by the rest of the blood in the body before it's sent out to the tissues. So we want it to be this kind of dark red color. Ox blood is kind of the color that I would call that, as opposed to this bright cherry red sort of color. And that if it's bright red And in the case of the horse, we usually put the needle in and look and see how fast the blood would be coming out. It should drip out. It should not shoot out like it's being sent up to the head in an artery. So that's why it's so important. We need the blood to dilute the amount of drug before it goes out to the tissues. So we want to make sure that we're injecting into a vein. Okay, and just to kind of complete that, if when we're doing either an intra-arterial, we aren't usually going in the artery. If we're doing an intravenous injection, we're going to um, make sure that it goes in by pulling, we insert the needle, we pull back on the syringe to make sure that we have the blood of the correct color, knowing that we're in the vein. We inject the medication into the vein, and then at the end we pull back to make sure that we are still in the vein, that we haven't pushed that needle through the vein and injected the medication into the tissues. What can happen is that if we have something that is pretty tissue toxic, we can actually get death of the tissue where it has been injected. There is no honor in not disclosing that you have gone outside of the vein. If you see a bleb around the area that you've injected, you've gone outside of the vein. It's really important to let your veterinarian know. And the next thing that we do is typically get some sterile saline and inject that around the site. And what we're simply doing is diluting the medication so that we can prevent any tissue toxicity. You can actually get tissue sloughing and open sores depending on the medication that you would have injected that goes outside of the vein. So it's very important. It goes in the vein, that you check to make sure that it does at the end of your injection. Okay, so some other routes that we do give medications are intramuscular. That will take a while for that to travel, get into the um, into the uh, arteries and veins, into the capillaries, um, and then into the animal system. Subcutaneous can take a little bit longer because that space isn't maybe as vascular as muscles are. And then intradermal. Intradermal is actually meant to stay close to the skin and not go too far away from it. And we usually use that for allergy testing. We're looking for a reaction to the material that we have placed in the intradermal space. Lastly, intraperitoneal. So you can see it would be very hard to hit a vein on this goldfish. It can be hard to hit it in rodents. Sometimes we use intraperitoneal injections in little lambs that we just want to get some fluids, warm fluids, and glucose into them. And it's absorbed readily from that intraperitoneal space into the vasculature.